Hello everyone, I'm Dr. Asha Rao, Director and Fertility Specialist from Rao Hospital, Coimbatore, Tamil Nadu. I'm really glad to interact with all of you through this live session. I'm Fine is a great initiative towards building a community of like-minded women and addressing the common issues that we face in day-to-day life. It is inspiring for me to meet all of you here, and it motivates me to be a part of this community and help you in a way that I can. It's a very good platform for clearing everyone's doubts. We have been receiving a lot of questions on pain during periods or menstrual pain from women of all platforms, all walks of life. I think it's a very, very serious condition which interferes with women's life. And we are here today to clear many of your doubts. And it is more of an awareness program. And if you have serious doubts further, you should definitely seek consultation from your own gynecologist before you take any decision. And we're not endorsing or criticizing any brand or any product. So I would refrain from using any brand name, and I would not like to comment on any brand. Let us keep it a clean and healthy discussion. So today's topic is menstrual pain. Is it serious? Is it endometriosis? As all of you know, every woman menstruates every month. Here you can see, this is the uterus in the center, and this is the ovary, and this is the fallopian tube. And every month, the woman produces the egg around the 14th day. And if there is no fertilization or pregnancy, menstruation happens around 28 to 30 days. This is the normal menstrual cycle. And during normal menstruation, there is no pain really, maybe a mild discomfort and a bleeding for 3 to 4 days with maybe a few clots. This is how a normal period is for every woman. And sometimes this can be very painful. And one of the important reasons for painful menstruation is endometriosis. Here I would say that this is the lining of the uterus, the brown color, that is called the endometrium. The endometrium has to be inside the uterus. If this endometrial tissue grows outside the uterus, beneath the ovary, behind the uterus, near the bladder, near the intestines, it is called as endometriosis. So if the endometrial lining grows outside the uterus or it is ectopic, it leads to endometriosis. These tiny, tiny deposits of endometrial lining outside the uterus, they behave just like endometrium. During the menstrual cycle, they respond to the female hormones, and just like the endometrium thickening, this endometriosis cells outside the uterus also swell up and they get blood supply and they break down just like the menstruation inside the uterus. The menstrual blood can come out through the vagina, whereas this miniature bleeding in the endometriotic deposits has no exit to the exterior of the body. So this miniature hemorrhage which collects in the endometriotic deposits causes intense pain, inflammation, and in future it can cause fibrosis, scarring, and distortion of the anatomy of the fallopian tubes. And because of scarring, the tubes can get blocked and it can bring down the future fertility, apart from causing so much of pain and agony to the woman. And we should remember that around 176 million world over are suffering from endometriosis. And of these, 30 million women are in India alone. Endometriosis can bring down the quality of woman's life. It's very sad. It's really an agony because this woman who is in severe pain sometimes cannot attend to her daily activities, cooking, office. And you can imagine if she's a pilot or if she's a big official, sometimes she may not be really able to do justice to her work. So it is really a condition which is enigmatic and full of agony. And what happens during the menstruation? Unlike the routine menstrual pain, which happens only during menstruation for 3 to 4 days, in case of endometriosis, the pain may start 3 to 4 days prior to menstruation. It lasts during menstruation, and it can also last for another 4 to 5 days after menstruation. But in some women, there may be mild pain only during menstruation. So the endometriotic pain is generally a cyclical pain which is related to menstruation, which is very different from the pain of, say, irritable bowel syndrome. Irritable bowel syndrome, people have a little intestinal disturbances and pain on and off through the month. Whereas the pain of endometriosis is cyclical pain related to menstruation. But sometimes it can be without the cycle. It can also happen in the mid-cycle. And these women can also complain of bloating of abdomen, fatigue. They can also have pain while passing urine, pain while passing motion, especially during menstruation. And these women can also have pain during intercourse. It's called as dyspareunia. To the extent that they may avoid having intercourse, this could also be one of the reasons for infertility. So endometriosis causes a lot of pain to the woman during menstruation, mid-cycle, and also during urination, defecation during menstruation, and brings down the quality of woman's life. So whenever somebody has serious pain during menstrual cycle, do not take it as normal. Olden days, the mothers used to tell the girls, no, it's all part of womanhood. You should learn how to tolerate pain. Do not take a painkiller. Do not go to the doctor. If you go to the doctor, they will give some names, and then you'll be branded as some disease. So do not go to doctor. You can just tolerate it. This is a myth. This is wrong. If somebody has serious menstrual pain, to the extent that it interferes with their life, with the quality of life, one should definitely investigate. And in young girls, the girls of 14 to 15, the college going or the school going girls, sometimes the pain can be so bad that they may not like to go to school. Frequent school absenteeism is common in women or girl children with endometriosis. So instead of just telling them, tolerate your pain, kindly take your daughter to the doctor and see whether she has endometriosis. Because if you catch it early enough, you can definitely prevent the progression, what I have described earlier, the damage to the ovary, damage to the fallopian tubes, and distortion of anatomy. All this can be prevented if you can prevent this and treat this right in the beginning. And once again, to summarize, the symptoms of endometriosis are painful periods. Pelvic pain and cramping may begin before and several days before menstrual cycle, through the menstrual cycle, and sometimes even after the menstrual cycle. They can also have lower back pain, abdominal pain, pain during intercourse, pain with bowel movements, pain during urination, and pain during intercourse. Infertility alone can be one of the symptoms of endometriosis. Because women are shy, they may not even like to tell you that they have menstrual pain. She would just say that, yes, I have married 5 years back and I do not have a child. And as you become a friend, the patient unfolds and they may slowly start telling you that, yes, I have menstrual pain. Yes, I do have some pain during intercourse. And I'm scared of intercourse because of the pain. So eliciting proper history is very, very important. If you have a good history, that will give you diagnosis in 80% of the cases. And other symptoms of endometriosis could be fatigue, diarrhea, sometimes constipation, bloating, nausea, especially during menstrual cycle. Menstrual cycles can be sometimes frequent. Sometimes one can also have long cycles, 45 to 60 days, and they can have heavy menstrual bleeding with clots. Sometimes maybe even an intermenstrual bleeding can happen. And you should remember that 1 in 10 women could be suffering from endometriosis, because the symptoms of endometriosis are just like any other vague abdominal pain. You may say this is a normal routine menstrual pain. You may say this is a urinary infection, and people tend to ignore it. So there is a tremendous delay in diagnosis, to the extent of, there may be delay for 7 to 9 years, because the definitive diagnosis or the gold standard for diagnosis is laparoscopy. And we do not really want to do it in young girls or the teenage girls. So with hesitation, we give them some painkillers and keep waiting. And there can be a tremendous delay before we reach a surgical diagnosis. So instead of doing a surgical diagnosis, in young girls, we can make a clinical diagnosis, avoiding a laparoscopy or avoiding surgery. Give them a therapeutic test. You can give them perhaps tablets or medication or oral contraceptive pills for 3 months. And if the pain subsides, you can indirectly take it as endometriosis. There are other medications also which you can use for therapeutic tests. And by doing a therapeutic test, you can avoid doing a surgical diagnosis and avoid surgery in this young women. I have some questions here. How painful are the periods with endometriosis? The pain during periods with endometriosis can be severe. It can be of stabbing in nature. It can be very bad. Women say that I have a feeling that I'm being torn apart inside. I have a feeling as if something is being pulled down. And surprisingly, sometimes women with severe endometriosis may have mild symptoms also. This type of condition also you will see. So that sometimes there may not be exact relationship between the severity of the disease and severity of the pain. What is the difference between period pain and endometriosis? The normal period pain is just a mild discomfort, maybe limited to lower abdomen during the first or second day of the menstrual cycle. If you take a mild fermentation or just a paracetamol, I think you get relief. Whereas the pain of endometriosis does not respond that easily to painkillers. People I have seen them even taking an injectable. They go to the family doctor and request them, please give me something, please give me an injection to relieve this pain. So it is a severe pain. And what is endometriosis? I have already discussed that endometriosis is the growth of the endometrium or endometrium-like tissue outside the uterus, near the ovary, near the bladder, near the intestines, behind the uterus. And this responds to woman's menstrual cycle, and it causes miniature menstruation when there is menstruation inside the uterus, and this blood cannot come out. So the trapped blood causes pain, inflammation, and scarring. And what are the symptoms? I have discussed once again. That is severe menstrual pain, pain during urination, defecation, pain during sex, and difficulty in bearing a child. All this could be the symptoms of endometriosis. And and how do we diagnose endometriosis? How does a doctor know that I have endometriosis? This is what one patient is asking. Many times the history itself gives you diagnosis in 80% of the patients. And if you do an ultrasound scan, you can see sometimes a cyst in the ovary, which is called as chocolate cyst. It is called chocolate cyst because the fluid inside this chocolate cyst is dark brown in color, because it's a miniature hemorrhage which becomes dark brown over time, and there is sometimes like a melted Cadbury. But remember, this chocolate cyst is not a sweet chocolate, it is a bitter chocolate, because the consequences are going to be severe in the form of damage to the ovary, adhesions. So if you do an ultrasound, you can see a rounded cyst in the ovary, and by laparoscopy, you see that it has got dark brown color fluid, and this is called as chocolate cyst. There are blood tests like CA-125, but these are not diagnostic. In difficult cases, you can do MRI, but the gold standard for diagnosis is laparoscopy. But as I said already, we are trying to do surgical diagnosis, reduce the number of surgeries or laparoscopy in young women. So what are the treatments for endometriosis? This is a very, very important question. The management of endometriosis is, number one, relief from symptoms. For relief from symptoms, you can take painkillers, NSAID. If you take paracetamol or ibuprofen, maybe you'll get pain relief. But these do not really cure the disease. They do not really bring down the size of the lesion. So you have medical management. You can give either oral contraceptive pills. You can give 21 tablets for 3 to 4 months, and maybe the pain will subside. Today we have better drugs which are known as progestins. There is 4th generation progesterone medication, which is a wonderful medication, which helps us many times to regress the size of the lesion. There is good pain relief, and the size of the endometriotic tissue can regress if you use it for more than 4 to 5 months. And these modern medications, the progestins, have got very good safety margin and very minimal side effects. And even in young girls, you can give it for a couple of years, and it may not cause any reduction of bone mineral density. Some other medications can cause, especially the injectable ones, they can cause reduction of the bone mineral density. Whereas if you use this newer progestins, there is no loss of bone mass. Side effects are very minimal, acceptability is good, and safety margin is very much there. So this is the wonder drug of the decade. In difficult cases, we can give injections. The injectable medications can give very good pain relief. They can cause reduction in the size of the endometriotic tissue, and it can also improve the fertility in the long run. But whenever a lady wants pregnancy, during those days, you cannot use this injection. You can use the injection, reduce the size of the lesion, followed by in vitro fertilization or test tube baby as and when required by the patient. And you can also do a surgery. Olden days, we used to do laparotomy, because my practice is more than 40 years old. In the first 15 to 20 years, we saw a lot of open surgeries. But almost from 1977, we started laparoscopy in our hospital, Rao Hospital. And right from 1990, we have been doing a lot of operative laparoscopy. And since those days, the number, I could say almost 30 years, the number of laparotomies have come down drastically, especially for chocolate cysts. We barely do any open surgery. It's always a laparoscopy, because by laparoscopy, the woman can get back to work quickly. The adhesions are less, healing is fast. And today the dictum is that even laparoscopic surgeries or any surgery should be done rarely, as much as possible in a woman's life of endometriosis, which we call as endometriotic life. Avoid the number of surgeries. I know women who had 2-3 laparoscopies, 1 or 2 open surgeries. And the more number of surgeries you do, the size of the ovary becomes smaller. The number of eggs will get, number of eggs will become less, and more adhesions can form. So always try to avoid surgery, and do surgery only if the woman has a lot of pain or large chocolate cyst, or there is a chocolate cyst which does not allow you to do good egg collection during IVF. So surgical management is good, but let us try to avoid the number of surgeries and treat these women by medication, because once endometriosis starts, they keep suffering throughout life. And even after surgery, there is a possibility of recurrence. So always after surgery, you must give medical management to reduce the chances of recurrence in these women, which is very important. And whenever women need fertility, after surgery, do not give them a long time, or do not go on doing IUI. So when you wait for a long time, perhaps the chance of recurrence are very high. In 1 year of waiting, there can be 20% of recurrence. And if you wait for 5 years, there can be almost 40% recurrence. So if fertility is a problem, and if the disease is mild, you can do IUI, 1 or 2 IUI. If the lady is not conceiving, then perhaps doing IVF is better than giving them a lot of time where the disease can recur and woman has to undergo a repeat surgery. So kindly avoid repetitive surgery in these women. So once again, somebody is asking, will endometriosis affect my ability to become pregnant? Yes, definitely so. I have discussed already that because of chocolate cyst, the number of eggs in the ovary can become less. And because of endometriosis in the pelvis, the tissues get stuck to each other, the fallopian tubes get damaged, and egg collection will go down. The receptivity of the uterus is also less for the embryo. So the chances of pregnancy are definitely affected in women with endometriosis. So it's very important to catch this disease in the bud, in the beginning itself, to avoid these women from getting into complicated stages. So what lifestyle changes can help manage endometriosis? Exercise is definitely very important because exercise produces interferons. Exercise brings down the level of stress. So stress management also is very important in these women. So exercise, stress management, avoid sweets, avoid chocolates, and avoid caffeine, and avoid too many drinks and smoking. And this can help you to manage endometriosis better. At what age does period pain start? When a girl starts menarche or attains age, first couple of years, the pain may be mild, and later the pain starts during the menstrual cycle. And in the later years, it can become worse, and it can also be there before menstrual cycle, during the menstrual cycle, and after the menstrual cycle. So whenever a girl child has menstrual pain, please tell the parents not to ignore it, take it seriously, and think endometriosis and fight endometriosis. These 3 years, I'm the chairperson for the All India Gynec Association Endometriosis Wing. I'm the chairperson for Endometriosis Committee for FOXY, and my motto is think endometriosis and fight endometriosis. So we have been doing lots of meetings for awareness among women and also among doctors about early diagnosis, the right ways of diagnosis, avoiding repetitive surgeries, and medical management, and what is the best way of treating these women. Because though the disease is more than 150 years old, we have lots of disputes in how to diagnose and how to treat. So it's very important for us to form newer guidelines to treat this disease in the right way. Is it normal to have no pain during periods? Yes. Many women have no pain at all during periods. So if somebody has significant pain during period, it is very important to consult your own gynecologist and talk to them about endometriosis. Ma'am, can I have a problem? Do I have any chocolate cysts? Do I have endometriosis? What is the reason for my pain? So every mother has to talk to the daughter, and if she has pain, do not quieten her down by saying, no, this is part of womanhood. Definitely take her to your doctor and consult. Does she have any fibroid, which is another reason for pain and heavy bleeding? Or is it fibroid, or is it endometriosis? I would say endometriosis is more common, more rampant, and there can be sometimes a delay of 7 to 9 years in diagnosis. And by the time the tubes are stuck, ovary is damaged, the fertility is down, and the suffering and agony is more. Can vitamins help with painful periods? Not really. For everyone nowadays, we advise vitamin D because it is related to so many diseases, but vitamins do not reduce the pain during periods. Is it normal to experience bad period pain? We have discussed a few times during this discussion that it is not normal to experience serious pain during menstruation. If there is serious pain during menstruation, one has to definitely consult the doctor and find out, is it endometriosis? Because endometriosis is a serious condition. It's like a cramp. It's like a form of cancer. It is not cancer, but once it catches somebody, it goes on troubling the woman, and it's a lifelong agony. So once again, my friends, if your daughter, if your sister or yourself have menstrual pain, do not take it lightly. Speak to your doctor. Ask what is the way of finding out whether it's endometriosis. And if it is endometriosis, definitely take proper advice from your doctor. Because if there is a delay in diagnosis, it can affect your intestines. It can affect your fallopian tubes, ovaries, fertility. In the long run, it can even sometimes destroy the kidneys because of the fibrosis around the urinary tube. So it is a serious condition. So you have to catch it early enough to prevent it from progression. What could be the reason for painful periods? This is the endometrium-like tissue which is outside the uterus. It has miniature hemorrhage during every menstruation, and this menstrual blood cannot escape. It has no exit out of the body. So it produces swelling, inflammation, pain, fibrosis, etc. So if somebody is suffering from menstrual pain, kindly speak to your doctor. I think this is the last time that I'm going to request all of you, because it's a serious condition to have endometriosis. So please speak to your doctor, have a proper diagnosis, and whatever advice your doctor gives, please obey it and have a follow-up at least once a year or twice a year by ultrasound scan. So thank you all for a patient hearing. I have enjoyed sharing my experience with all of you, because our motto is think endometriosis and fight endometriosis. So I hope and I'm sure that you have enjoyed my discussion also. And let us all meet once again at this I'm Fine platform. By listening to me, I'm sure you're going to say, I am fine, because you have gathered so much knowledge today. So you say, I am fine, I will be fine, and do everything the right way. Thank you all and have a nice day. Bye-bye.